Good. Well, let's start with the beginning, Bailey, and we're going to do a manipulation to see if everything's where it belongs and how he's doing.
Okay, Bailey. He's a beagle, so he smells everything,
my God, yes.
of course. Sit, Bailey. Sit. Good boy. Okay. Bailey's wrist is really affected because of his injury too. It doesn't bend as far up as it should, but that's about as far as it can go. So I move it to its range of motion so that we can see that nothing's hurting him when we do it and it's working, that it's no worse than it was before.
Question, Edie. Some dogs, I know I had a collie one time, and I had a collie that you could have done anything to, and he wouldn't have cared. And I was always afraid I was going to do something more than maybe I should because he didn't respond to anything. I have another dog that if I moved him just the slightest amount, it was like, oh my God, you're touching me, and it really hurts. So I'm sure that came with your training, that you have some idea how to know whether or not you're hurting him because they don't always tell you.
Yes.
And he looks pretty passive, so.
Yeah, he is. A lot of times if they aren't the kind of dog that's going to cry when you do something, what you do is by feel. If he tenses up or pulls back when I go to do it, then I know that's bothering him. If he's not tensing, then he's really comfortable with what I'm doing and everything's fine. He's really relaxed.
Sure.
And I never do it to where it causes him pain. I just want to make sure that he's got range of motion, he's moving, he's got good range of motion in his shoulder. Flexion is the bending, extension is the stretching, and he doesn't have as much in the stretching of his shoulder. And his elbow, he does really well with his elbow, but his shoulder and his wrist are the ones that are affected the most.